Take a deep breath for me. Hello, I'm Kwan Siu. Chapter 4, The Claw Machine, 30th January 2022, Sunday. I went to your room and you were not there. Where exactly are you? Dr. Devo called late in the evening. I am waiting for my COVID test result, I answered timidly, taken by surprise as I hadn't expected to hear from him this evening. After an early dinner with Wano, we arrived at the hospital. It was a Sunday evening. The admission desk was sparsely staffed, leading to an unexpected wait of over an hour. Yes, the nurses told me you are doing your COVID test. I am now at the COVID test area. I didn't see you, he said. I am waiting at Starbucks, I replied. Don't go anywhere. I am coming to you. At 9 p.m. on a Sunday, my doctor was frantically looking for his misplaced patient, navigating between buildings of a hospital that sprawled across several blocks. Although I appreciated his dedication to my care, at that moment, his urgent need to see me highly alarmed me. He arrived soon after in his weekend casuals, a polo shirt from a local gym, and jeans. There was no one else in the cafe apart from us and the staff behind the counter. Now you understand why I asked you to come in tonight instead of tomorrow? They are so slow. If you come in tomorrow, you will have missed your surgery time, he explained while pulling a chair over to sit down. Uncertain about whether to offer him a beverage, I found myself in an unfamiliar situation as I had never been in such a setting with any of my doctors before. However, he decided for me by choosing to continue the conversation and not allowing me to slide a word in. The reason I need to see you this evening is to explain to you what will happen tomorrow. I have planned on having an emergency blood transfusion on standby since, as we have discussed, this is the kidney and there is a high risk of excessive bleeding. There is also an ICU on standby in case things get complicated, he explained. And although we have a clear picture of your tumor from the CT scan, we might encounter something unexpected inside. If I see a threat of it being malignant, I will need to remove your whole kidney, just so we are clear. Of course, if that situation arises, there will be no need for the robot, but we don't know for sure, and I hope we don't need to, he highlighted. I was familiar with everything he mentioned, and though I felt a bit uneasy, it didn't escalate to the point of an anxiety attack. I was quite proud of my composure this evening. I continued to sip on my overly sweet hot chocolate, and soon after, admission called to inform me my RTK test was negative and they were ready to escort me to the ward. I found myself in a spacious and comfortable room, and I was glad. It was twice the size of my bedroom at home. Unsure of how to occupy such a vast space, I made sure Yoda had his own bed to ensure his comfort. It wasn't until midnight after I had settled in that I finally had the opportunity to catch up on my text messages. I was overwhelmed by the cluster of prayers and well wishes from those who were aware of my surgery, although there weren't many. Not many knew because I didn't like to sensationalize the situation I was in and turn it into a tacky lust for empathy and attention. Surprisingly, despite my nervousness in the hospital, I slept well, and that was enough. 31st January 2022, Monday. Good morning, Dr. Devo greeted us excitedly as he came into my room. We have checked and rechecked the robot this morning and everything is working well and ready for you, he informed. While this announcement caught me off guard as an engineer, I appreciated this piece of information, recognizing the susceptibility of equipment to failure at the most inconvenient moments. After he left, I was pensive. The impending surgery weighed heavily on my mind, and a multitude of thoughts raced through me. I had gone from calm to turbulent in a repeated cycle, fighting a mixture of competing emotions, each of them vying for dominance. I thought after the reboot of sleep I was able to face this grand episode of my life, yet this angst decided otherwise. Overthinking left me exhausted and I fell into a light, dreamless doze. The nurse woke me up shortly after noon, instructing me to change into a surgical gown and put on a pair of compression stockings. I was not used to wearing stockings of any kind and found them thoroughly uncomfortable and irritating. I tried to talk my way out of it, but she insisted it was necessary to prevent blood clots from developing in the legs, called deep vein thrombosis, also known as DVT, due to limited mobility after surgery. She continued to emphasize that there should be nothing else worn underneath the gown and I was to remove contact lenses and dentures if any. While these clinical directives were routine for her, they made me paranoid to the point where I had to validate for myself the presence of contact lenses and dentures on me even though I had never worn either before. My surgery was scheduled for 2 p.m. yet at that time I was still in my room. Uncertain if surgical delays were common, they came for me approximately 30 minutes later. I got up and was about to get down from the bed when the nurses instructed that I should lie down. They were going to push the bed to the operating theatre, also known as OT. I told them I could walk. It is not whether you can walk now, it is for when you cannot walk back here after your surgery. The nurse answered, I had not thought about that. Lying on the bed while being transported by others felt a bit peculiar. The journey to another building housing the OT was quite extensive. With nothing else to occupy my time on the moving bed, I resorted to staring up at the ceiling and began counting lights. Even though this happened a lot in the hospital, I still attracted attention, which was something I was not comfortable with. We navigated in and out of lifts, not sure which amazed me more, the capacity of the lift car or that my entire entourage was slim and petite enough to fit in there together with me. Throughout the long commute, I was searching for my jitters, but it was not there. I was surprisingly calm, and that was very unlike me. I should be proud of myself, but instead I was confused and uncertain by this empty emotion. We soon reached the entrance leading to the OT. Yoda had to leave me at this point. I started to get a little tense, but I knew he could not follow me inside. As the automated doors opened, I was pushed into a corridor very much like a staging area. I was parked at the side while the ward nurse handed over my documentation to the OT nurse, like a delivery of sorts, and I was the parcel. I was then left alone for a few minutes before the OT nurse came back with a disposable non-woven head cover and asked me to cover my hair with it. Managing this task while lying down proved a little challenging, but I got it done, suppressing the urge to ask for a mirror because I knew I looked hideous. After checking my wrist tag and reconfirming that I was indeed who I was pushed into the pre-op area. The space was congested, with beds nearly colliding, making it evident there was no room for me there. Consequently, I was sent to one of the cubicles in the post-op area, where it was warmer due to the presence of heaters for post-op patients. Then I was left alone, surrounded by those who just came out from surgery, with the ghastly sound of moaning and retching, alarming beeping of the machines, and frantic footsteps of nurses and technicians in there trying to ease the discomfort of patients. A clock high up on the wall, directly in my line of sight, indicated that the time had surpassed 3 p.m. Yoda must assume my surgery had commenced. No one came for me, and I continued waiting, wondering if I was forgotten, being hidden here, not among my peers. Well, at the very least, I knew Dr. Dewo should know to look for me if I failed to pop up at his OT. Moments later, a friendly woman approached me and introduced herself as my anesthetist. Dr. Guest wore a bright smile and exuded enthusiasm as if we were going to embark on a frolic in the meadows. Her cheerfulness was striking, especially considering her daily dealings with people in distress. After posing a few health-related inquiries, she sensed my anxious demeanor and asked if there was anything she could do to elevate my unease. What is it like going under GA? I asked. It will just be like going to sleep, she said. Will I feel time passing? No, you will stay in a state of total unconsciousness, she explained patiently. What if something unexpected happens right in the middle of it? I will be there the whole time to make sure no harm will come to you. In this instance, I finally unlocked the source of my fear, which had been unclear to me before. I didn't like to lose control, and being in a state of induced total unconsciousness distressed me. The only person I trusted to make decisions for me was not able to be in the OT with me, while I had confidence in the competence and experience of the entire team in the OT. I lacked sufficient familiarity with them to find reassurance. It was also not helpful to feel that I was just another job for them. After Dr. Gass went through all my concerns, she left me and promised that she would see me at the OT. I was calm towards a little bored now, lying down with nothing to occupy my time. 4 years of torment and agony had brought me to this moment to confront my fear. Acceptance of it liberated me. Upon this realization, a feeling of warmth flooded my being like an unspoken reassurance. I offered a short prayer of gratitude for this awakening and for all the arrangements that have brought me to this very moment. Peace comes not from the absence of trouble, but from the presence of God, quoted Alexander McLaren. I believe it was almost 4 p.m. when I was finally wheeled into the OT. It was not a big room, lacking the high-tech and sci-fi aesthetic seen on television. Nevertheless, it exceeded the size of my living room and housed an array of equipment. An energetic group of people hurried about, and while I couldn't confirm if all were involved in my surgery, the atmosphere suggested a potentially lively environment when I was unconscious. The first thing that caught my eye upon entering the OT was the renowned Da Vinci robot, which I had sulkily nicknamed the claw machine. It struck me as amusing that I could identify it despite never having seen it before or Googled about it. At that time, I believed that the less I knew, the lower the chance that I would be terrified. The Da Vinci is a surgical robot designed for minimally invasive procedures. It has 4 arms equipped with surgical instruments and cameras that the patient controls remotely from a console. It enables surgeons to perform delicate procedures like mine with better precision and visibility. There was also a massive screen hung high on one wall. I was uncertain whether it was intended for everyone to observe Dr. Devo's actions or if it served other functions unrelated to my surgery. On the ceiling were blindingly bright surgical lights, which made me a little nervous. I was not sure why. The overall appearance of the OT resembled a somewhat disordered industrial kitchen with off-white walls and vinyl flooring, despite the random life-saving equipment and stainless steel shelves scattered along its perimeter. In the middle was the operating table, and now my bed had been positioned beside it. The process of transferring me from my bed to the operating table seemed like an effortless slide. It felt awkward for me at this point, being quiet and still, while everyone around me was handling me like a slab of meat without so much of a greeting. It was a relief to see Dr. Gass, a familiar face in there, among all the chaos. I didn't see Dr. Devo, which spooked me a little because I really didn't want to be unconscious without validating if I was in the right OT or with the right surgeon. However, I had a vague sense that he might already be present, possibly standing behind me, observing while awaiting the preparations to be carried out. I found myself shaking excessively. I was not sure if it was from cold or from nerves. Dr. Gass noticed and quickly threw a hot air blower under the sheet that covered me. She then asked me to sit up so that she could attach stickers to my back. "What are these for?" I asked. "To hook you to the machine that monitors your heart," she explained. Everyone seemed to be in a rush to do everything, like a pit stop team at Formula One racing. Was it because we were behind schedule or that they work at this momentum all the time? I had no clue. As I lay back down, one of the nurses removed my face mask, replacing it abruptly with a gas mask without warning. The gas was intended to render me unconscious, but on reflex, the foul smell had caused me to turn my head away. The nurse moved the gas mask to my face again and I shifted away. If it was not such a critical situation, it might have been a moment of amusement. Eventually, the nurse had to assertively instruct me to stay still and inhale the gas. Within seconds, I could feel my body relax and my eyelids getting heavy. The surgical lights on top were slowly dimming. I could see rainfall of tiny dots descending onto me like droplets of water. And then there was nothing. I was awakened by the murmur of vague background sounds in the post-op area. Everything appeared hazy, with several figures hovering over me, though it could have been just one. I couldn't be certain. I was aware that the surgery was over. I was not in shock, not even confused. No pain or discomfort registered. Dr. Gass did her job adeptly. Time seemed to elude me. The whole surgery seemed to have happened literally like a blink of an eye. If I had done my research earlier, I would not have stressed so much about this situation. General anesthesia, also known as GA, was more than just being asleep. It stopped pain signals or reflexes from going to the brain. Overall, GA is very safe. Most people were able to undergo it without serious problems. Older adults or those with serious health conditions may be at risk of post-operative complications. Amid the muddled background noises, a nurse repeatedly called my surname, an unfamiliar address, as I was accustomed to being called by my given name. It took me a while to grasp that she was calling me. Although I wanted to tell her I was awake and I was fine, I found myself unable to speak, indicating that I wasn't as fine as I initially thought. Then I heard the deep, distinctive voice of Dr. Devo. While I couldn't distinguish the specifics of what he was saying, the words, "The surgery is successful," stood out. I tried to determine where he was, but everyone around me was still a blur. His voice seemed to have come from the edge of my bed. The small gesture of moving my head about made me giddy. I closed my eyes again and fell into a doze. I was jolted awake when I was being transported back to my room. An open bath bag beside me suggested a high likelihood of nausea. My vision had improved. We were crossing the bridge that linked the buildings within the hospital. Outside, it was already dark. Uncontrollable shivering set in, an unpleasant sensation. I drifted back into a doze, perhaps my body's response to cope with this excessive quivering. Post-operative shivering is a common complication of GA caused by preoperative hypothermia, attributed to anesthetic hindering our body from regulating its temperature. It can sometimes cause a great deal of discomfort, like what I was experiencing. Although it can be distressing, shivering is not usually dangerous and should go away after a while. However, no one explained this to Yoda. He was shocked when he saw me trembling like a leaf when I arrived at my room. The nurses could only offer a brief explanation, attributing it to a side effect of GA. I wanted to open my eyes, but my eyelids were heavy. I wanted to speak, but my mouth could not move. My jaws were clenched tightly, trying to fight the uncontrollable shivering. Yet I could hear all that was going on around me. I could hear Yoda fielding phone call after phone call. From his side of the conversation, it became apparent that he had been managing these calls long before my return. He was not informed that my surgery was delayed, and no one updated him I was staged for a period of time at post-op until later. As far as he was concerned, my surgery went on for more than 6 hours when it was expected to be just around 4. It was the first time I heard fear lacing his voice, and I didn't want it to be because of me. I needed him to be the stronger and calmer one for both of us. It distressed me to hear him lose his nerves. At least at this very moment, he could update my family that I was out from the OT, although trembling intensely. All of a sudden, I discovered that I could move my arm. I waved it aimlessly, blindly seeking what I didn't know. Then a warm hand firmly gripped mine and I held onto it tightly, unwilling to let go. It was Yoda's. I clung to Yoda for what seemed like an eternity, and he didn't let go. Finally, a sense of safety enveloped me and my panic began to subside. When I could open my eyes, I saw Yoda beside me, confusion and agitation slowly leaving me. I realized my shivering had ceased and I was breathing normally and comfortably. It also didn't escape my notice that I felt neither pain nor discomfort. I felt nothing. Knowing there were tubes connected to me, I was reluctant to move my torso for fear of dislodging everything. Dr. Devo came by to see me a little later in the evening. For one who had been in and out of surgical scrubs and worked such long hours, he was, surprisingly, immaculately dressed at this late hour, not a strand of ruffled hair. "How are you feeling?" he inquired. "I am feeling nothing. What magic have you done?" I asked nonchalantly. "Of course we want to keep you as comfortable as possible. We are feeding you with 3 painkillers." He boasted as if painkillers were his invention. "Do I need 3? "Yes." "When can they be removed?" "For tonight you are going to get some rest. We shall decide tomorrow. Please try to get out of bed tomorrow. and do a bit of walking outside. It will be good for your recovery. Walking after surgery was one of the most important things one can do to prevent complications. It helps the flow of blood around the body, which is important for wound healing. Walking also strengthens the muscles and promotes digestion and urinary tract function. Despite the late hour, Dr. Dewar stayed to make sure all my questions were answered and my doubts put away. I felt better, although a little disgusted with the lack of opportunity to take a shower. I still could not believe the part which I most feared was over. Now, however, came the stretch of dread. 1st February 2022, Tuesday. Good morning, how are you feeling today? Dr. Dewar walked into my room with his morning enthusiasm. I am good, I think. A little challenging to feel anything when one was euphoric with painkillers. All your vitals are splendid. Your blood test came back fine. Your blood pressure is great. You don't need blood transfusion. We don't need the ICU. Everything is well. He chirped merrily. Now that you are rested, I want to tell you about your surgery. He rattled on about what he did in the OT with hardly a pause in between. I was slowly absorbing it all in, relieved that this ordeal was over and the source of my unease was removed. There is not much you need to be worried about. Everything is clear. The tumor and the renal bed have been sent to the lab. I expect to hear from them soon. He continued. Upon hearing this, a feeling of dread washed over me again. Did he not just tell me everything was clear? Whatever little marble was, I didn't want to know. I have a picture of your tumor. Do you want to see it? Dr. Dewar was exhibiting excitement like a proud father of a newborn. No, I don't. Keep it to yourself. I replied quickly. I'm going to show it to you anyway. And he proceeded to shove his phone in my face. He was an asshole like that. It was entirely because of good manners that I didn't punch him in the face. Then I turned my attention to the image on his phone. Limbed and punctured on a bed of turquoise covering lay little marble. It didn't look aggressive or intimidating now. Dr. Dewar continued talking, but I didn't pay attention. I was just staring at little marble, imagining it existing inside my torso, hanging on to the bottom of my right kidney for more than 4 years. At the time of surgery, little marble was not little anymore. It had a width of approximately 4 centimeters, which was bigger than the size of an average marble. Since I was not paying very much attention, Dr. Dewar answered questions from Yoda, who had a psychotic interest in blood and gore. After that, they turned their attention back to me. Do I still need 3 painkillers? I asked. If you want, we can remove 2 today, said Dr. Dewar. Okay, do that, I affirmed, determined to be rid of their side effects. Bear in mind that once they're off, you will start to feel pain and it could be bad. It is still alright if you have them for another day or 2, he warned. We can put them back in if needed, right? Yes, but of course, they take time to work. I was a little nervous since I had not been in a situation of extreme pain. Not wanting to delay him, I've psyched up myself. I didn't even know where my courage came from and made up my mind. Remove them. Okay, I will give instructions for them not to continue, and I will come by to see how you are later. With that, he left us to continue with his day. I attempted to sit up for breakfast, which was a little irritating since there was a catheter in my bladder. I felt bloated, didn't have much of an appetite, and my limbs were a little heavy. I could not remember what I ate. Hospital meals were not known to be fancy, but I didn't much care. After I fasted for almost a day for surgery yesterday and didn't eat much after that, at this moment, I just wanted to make sure I filled my stomach with something. After breakfast, with Yoda's help and encouragement, I attempted to get out of bed. With some of the painkillers being turned off, I was beginning to feel some soreness in my abdomen. Even though my legs felt weak, I managed not to fall. Walking about required more care though. I had a catheter attached to a urine bag and there was also a draining tube coming out from my abdomen that ended up in a suction container. The nurse gave us a bag to carry this big set of paraphernalia and a rope to cover my thin surgical gown, and then off we went. If it was up to me, I would prefer to lie down in bed with my kiddo. But Yoda would not take no for an answer. He took doctor's orders very seriously when they didn't consent him. Very slowly, we made our way out of my room and circled the entire ward twice. I felt a sense of accomplishment. When we returned, there was a bouquet on the overbed table with the message, "Sorry to hear about your surgery. It won't be the first time you've laid on your back whilst a fella fiddles about inside you." It was anonymous, but I very quickly figured out which sick bugger sent it. Stefan had always been a world-class jokester since the day we met. We were in the same faculty at university and shared lodging accommodation. He was like a brother to me, and together with our other boisterous roommates, they taught me how to swear in German and worship football. Dr. Dewo came by to see me again during lunch, and, from the look on his face, surprised to find me out of bed and in a chair across the room instead. "Any pain?" he asked. "Yes, I am beginning to feel sore," I reported. "Do you want back the painkillers?" "I think I can manage." I proudly updated him on my turn around the ward, which earned me a "well done." While he was still here, a nurse entered to administer an antibiotic injection. The sight of it made me cringe each time I had to brace myself for agony as they injected the thick solution into my veins via the cannula. Today was no different, but I was taken aback by an intense surge of pain this time. I caught my breath and nearly screamed. "Stop! You have to stop! She is in pain!" Dr. Devo hollered at the nurse. "The line is blocked! You don't force it!" His outrage on my behalf surprised me. I didn't expect calm-mannered Dr. Devo to exhibit a display of heated irritation. I didn't enjoy seeing him reprimand the nurse, but his focus and dedication to my comfort left a warm feeling inside me. After giving instructions for a new IV line to be set for me, he left and came back after dinner. By then, I completed another walk outside. "I am coughing a lot," I told him. "It is from your surgery. Our kidneys sit just below our lungs and our lungs cover part of them. During your surgery, we might have disturbed the lung a little bit and that irritated it. You might be coughing over these few days," he explained. He saw a folded towel nearby and he brought it to me. "Press this onto your wounds when you cough to suppress the pain," he instructed. Oh gosh, I was not going to like this. I didn't feel great that evening, mainly because I didn't have a shower. I was disgusted with myself. My hair was clumped together, my scalp was slimy, and I didn't feel comfortable in the hospital gown. There were no instructions from Dr. Devo that forbid me from taking a shower. However, I didn't feel like going into the shower with a urine bag and a drainage container and getting all my bandages wet. I was able to walk to the sink to brush my teeth, and that was delightful. I was coughing repeatedly throughout the night, tightly clutching the folded towel to my abdomen. It was agony. I still had one painkiller working on me, which was the wimpy paracetamol. However, it didn't tackle this discomfort very well. I didn't usually sleep on my back, preferring to curl on my side. The draining tube and catheter were in the way of my doing that. I didn't sleep at all and it was wretched. 2nd February 2022, Wednesday. Shortly before 8 a.m., Dr. Dewo came to see me. "I'm sorry if I am too early today. I want to see you before I go into an 8-hour surgery," he explained. I didn't think he was sorry. To him, the world should revolve around him. It didn't matter to me since I was awake anyway, and it was kind of him to come to check on me before his critical challenge ahead. "I am still following up closely with the lab about your tumor. They are at the final stages of confirming the outcome. Just a bit more testing with more chemicals. We shall hear from them very soon," he announced. He was the only excited person in the room at this moment. I was not very interested to know. "How are you feeling today?" "I need something for my cough, preferably one that can work a miracle," I requested. Yoda was surprised but pleased, as he was well aware that I had a strong aversion to any form of medication. Throughout our marriage, he was always berating me for enduring unnecessary suffering due to my stubborn refusal to take medicine when unwell. Witnessing me in pain was something he disliked, and the only reason I overcame my aversion this time was that I had reached the limit of my endurance and was thoroughly exhausted. "Can I turn on my side when I sleep? I don't sleep very well like this," I asked. "Just be careful not to dislodge the draining tube. If it comes out, I cannot put it back in again," he warned. After breakfast and my oral medication, I finally fell into a long, craved doze, only to be abruptly awakened by the blaring sound of Yoda's phone a while later. It was not even a phone call. He was watching videos. This had been a constant struggle I had with him. He just could not use earphones when the situation warranted them. I screamed bloody murder, then broke down and cried quietly as I had reached an indescribable level of agony. I was overly exhausted, my head was pounding, my cough was getting worse and was amplifying my abdominal pain from my wounds, and my eyes were burning from restlessness. I was very close to asking the nurse to administer additional painkillers again, only my distaste for their side effects held me back. I made a conscious effort to regain my composure, reminding myself to be grateful that Yoda had put aside his other commitments to be with me. He had a demanding workload, and it was not in his nature to be idle, although to many this seemed like the obligated thing for a husband to do. Nevertheless, I was not one to take anyone for granted, unnecessarily, even my husband. I existed in a torturous state of weariness for the rest of the morning. When sleep continued to elude me, I opted for another walk. Surprisingly, I accomplished more rounds today, which surprised me. My family came to see me. They could not stay for very long due to strict COVID-19 regulations, yet it was still the grand highlight of my day. After lunch, I finally managed to get some sleep. I didn't expect to see Dr. Devo again today, since he was having a challenging day in the OT. However, he burst into my room right before bedtime. I have news from the lab, and I must deliver it to you tonight. But first, let me ask you, has any one of the urologists that you've seen ever asked you to remove your kidney? He asked solemnly. No, just part of it, I replied hesitantly. What was he getting at? Not a single one of them asked you to remove your kidney? He asked again, more serious this time. No, I answered guardedly. I didn't know where he was going with this. The reason I ask is that I have the result from the lab. The report is not yet out, but they are comfortable for me to disclose this to you. At this point, I think Yoda was more impatient than me. Your tumor is... Suspenseful pause. 99.99%. He paused some more for dramatic effect. At this point, I should suggest he audition for the role of a circus magician. Benign. The word was said so softly it was hardly heard. Yoda could not hear him very well from where he was, and he had to ask again. While they were still in conversation, I just sat on my bed, staring daggers at Dr. Devo. Was I relieved? Yes. But did I fall for his sick prank? No. He might not have realized it. He had contradicted himself royally. Right after my surgery, he had told me we had nothing to worry about. He had done a brilliant job, and now he was trying to scare me into a full nephrectomy. Right now, I don't like you very much, I told him. Yes, sometimes I don't like myself very much too. He was laughing wickedly now. So what was it? I had to know. Let's just say it was a bunch of degenerating tissues, he said matter-of-factly, probably because it might take forever to explain anatomy to me. Degenerating? I repeated to myself. I had not heard of anything degenerating by itself inside the body before. I told the lab if it was cancer, they should inform me immediately, and if it was not cancer, they should inform me even sooner. You don't need chemo, you don't need more CT scans, and you don't need to worry. You can sleep well tonight. Dr. Devo rattled on like an automatic rifle. Where did he find the energy at this hour of the night continued to baffle me. After Dr. Devo left, Yoda and I delved further into a discussion about Little Marble. It was good news, of course. Was this surgery necessary? We both believed it was. There was no distinct way for anyone to diagnose Little Marble accurately. On the scan, it looked highly suspicious. I felt foolish to have gambled with my life for 4 years. Despite my attempts to avoid it, undergoing this surgery was inevitable. 3rd February 2022, Thursday. Today, Dr. Devo entered, and the entire room was permeated with the fragrance he was wearing. Did he accidentally spill perfume on himself or perhaps go a bit overboard with it? The scent lingered in my room continuously until lunch. What a compelling way to leave a lasting impression on his patients. It was fortunate I was not allergic to scent. Why does my skin feel like bubble wrap? I asked. My skin crackled when I pressed onto it. I noticed it since the day after my surgery, but kept forgetting to ask him about it. During your surgery, we inflated your abdomen with air so that there was space for the probes to move around. You were bloated like a pregnant woman. After that, we pressed out all the air like we deflated a balloon. Some air bubbles got trapped under your skin. They will go away in a few days, he explained. Not very fancy with words. The blood in your urine has cleared. We can remove the catheter today, he continued. What a relief! That was the best news. Although the catheter didn't cause pain, it was mighty uncomfortable. Now, let us have a look at your wounds. From the day of my surgery until now, I hadn't had a proper look at the bandage concealing my wounds. I was informed about 5 incisions, but their exact locations were unknown to me. A large, square waterproof bandage enveloped almost my entire right abdomen. When Dr. Dewar finally removed it, I could observe 5 smaller bandages marking my incisions. Among them, I noticed the draining tube emerging from one. He proceeded to peel off one bandage. Your wound is healing surprisingly fast, he observed, and proceeded to peel off all the other bandages. They're all great. We don't even need to cover them anymore. I will just spray this bandage spray over them, and proceeded to direct a cold aerosol spray onto my abdomen without heads up. I almost leapt out of bed. I was screaming for him to stop, but he ignored my pleas. He kept spraying like an unstoppable madman. Was that what happened with his perfume bottle this morning? Who would have imagined Dr. Dewar had a playful nature? However, he had to rebandage the wound with the draining tube. Where is the surgical tape? He asked the nurse. When she could not produce one, he started berating her. Why is there no surgical tape on the dressing trolley? Please ask the nurse manager to see me. I want to know how she runs the ward. Ouch, that was nasty. While I wasn't at ease witnessing this heated confrontation, Yoda was all eyes and ears. He very much enjoyed the drama that ensued. The nurse quickly rushed outside and came back with a clipping of tape. Is that all you have? You billed the patient for a roll of tape and you gave us just one square. Bring me the entire roll. Dr. Dewar was losing his patience and I wanted to sink into the coverings of my bed. When the nurse returned with the entire roll of tape, Dr. Dewar pulled out the amount he needed and proceeded to bandage my wound. He then placed the roll of tape on my bedside table. Make sure this roll of tape stays here. It belongs to you. You have paid for it, he instructed. Yes, sir. I didn't know whether to burst into laughter or tears at that particular moment. A nurse arrived later to remove my catheter and urine bag. With fewer attachments, I felt less burdened during my walk. I could also finally discard my compression stockings. I relished this newfound comfort like a child. Dr. Dewar came back to check on me a couple more times throughout the day. Surgical wounds were still the main cause of my pain and discomfort, coughing second. But overall, I had more to celebrate than to agonize over, and incredibly blessed with a doctor who was single-minded in his pursuit of my recovery and comfort. 4th February 2022, Friday. The draining tube would be coming out today, and I was brimming with excitement and impatience. After breakfast, I desired a shower. Since my only bandage was due to be replaced today, I had no qualms about getting it wet. Yoda helped me into the shower, unfolded the wall-mounted seat, and instructed me to sit while he hooked my draining tube and container to the bar on the wall. Then, without warning, he sprayed water on me with the handheld shower, like he was washing a car. I squealed like a drowning rat. Note to self, exercise caution around less sensitive men wielding spray objects. Having my hair washed again was a delightful experience. After all, I prided myself on being a very hygienic person. I learned never to take showers for granted again. After thoroughly cleansing myself, I felt so invigorated that I lingered under the hot shower until Yoda eventually lost his patience. I was dressed and in bed when Dr. Dewar came in. A nurse followed with what I presumed the dressing trolley, hopefully for her benefit, thoroughly stocked. I'm going to remove the tube and send you home today, Dr. Dewar exclaimed while putting on gloves. I was smiling jubilantly and incredibly excited until I saw him unwrapping a pair of sterilized scissors. What is that for? I was beginning to get nervous. To remove your stitches, he answered. What stitches? The ones that tied the tube to your wound. The tube was stitched to my body, and you didn't see fit to let me know when I asked if I could turn about during sleep. I could have slept more comfortably if I knew there was a minimum chance that the tube might dislodge. Come on now, don't move if you don't want me to accidentally cut your skin. He drove me crazy. After he cut off the stitches came the agonizing part. It took him considerable effort to yank out the thread, as my wound dried faster than expected. Did I scream? Most definitely. I believe I almost broke off the barricades of the bed I was holding on to. Women complain about everything. I gave you bikini wounds instead of giant massive ones, and yet you are still unhappy, he retorted without sympathy. Now, take a deep breath for me. He instructed, and then proceeded to pull the draining tube out from my abdomen. My eyes almost popped out of their sockets as soon as I saw the length of the tube that was in my body. No wonder I was uncomfortable. Okay, the wound looks good. Tell you what, since it is healing so nicely, I am going to leave it as it is, he said. What? You're going to leave a hole in my abdomen? Just like that? I was horrified. It is going to be fine. Nothing can get in there, even if you try. He answered simply and proceeded to spray more of his signature cold bandage spray on me, again, without warning. I will prepare your discharge documents. As soon as your insurance company processes your claim, you will be free to go. Take care and get plenty of rest. Give me a call if there's anything. With that and a cheerful wave, he left. Yoda did most of the packing as I was still sore. What do we do with this roll of tape? He asked, holding up the tape which Dr. Devo ceremoniously placed beside my bed the day before. Bring home? I was not sure either. Devo said it is ours, so let's take it and decide what to do with it later. Does that mean this box of gloves is ours too? Yoda asked. The scenario was becoming mighty hilarious. We could well be leaving the hospital with toilet paper too. Although the hour was late, Wano waited to have dinner with us before our journey home. I had a heavenly meal of seared fish at an intimate restaurant in Wano's neighborhood. After days of bland meals at the hospital, this was wonderful. And Wano knew just what I needed. Happiness was having a cousin who liked to fuss over me. During the long journey home, Yoda and I had plenty of time to reflect on this major event in my life. Despite all the pain and discomfort that I had gone through, I didn't resent it happening. My circumstances could have been worse, but they were not, and for that I was grateful. Every night in the hospital, before I went to sleep, I thank God for releasing me from the torment I inflicted on myself due to my lack of faith. Just when I thought I was lost, I was sent to this superhero who called himself a urologist. I had yet to know if he was the most brilliant doctor, but he was already a cherished person to me. Ever since we discovered the existence of Little Marble, Yoda had been adamant about this surgery. I would deny that he was right, only that I was too deep in denial and too stubborn to accept help. We suffer more often in imagination than in reality, quoted Seneca. The week following my discharge was uneventful. My movements were slower than usual since there was still some soreness deep in my abdomen, and I was careful not to overexert myself at home. For most of the time, I was lying down with my Kindle. Yoda liked to bring me out with him and sometimes park me in his office to keep him company, although most of the time, I was just napping on his sofa. Since I had not been taking medication for a long time, it was a struggle to remember to take my antibiotics on time. I had to set reminders on my phone to alert me. Another challenge I was facing was the little hole in my abdomen which Dr. Dewo didn't want to stitch up. I was very self-conscious of its existence, and thinking about it freaked me out. The vexatious cough had not gone away, and it sometimes kept me up at night. 11th February 2022, Friday. Your surgery wounds are healing very well, said Dr. Dewo, 1 week after I was discharged, and he proceeded to spray my abdomen with the blasted bandage spray again. Never thought he had it in his office too, bollocks. The thing with the bandage spray was, although it was very convenient, after a few days it came off in the shower like yucky wet spider webs. Here is a copy of your report with colorful pictures for you to keep as a souvenir. He went through everything with me. The images on the report showed little Marble was sliced and dried up now, almost like chopped shiitake mushrooms. The pathology report suggested that little Marble was a degenerated angiomyolipoma lesion. To feed my curiosity, I scoured the internet for answers. I was not a pathologist, but my search results told me that renal angiomyolipoma was a tumor in the kidney. Almost all were benign, but they could hemorrhage, which could be life-threatening. In scans, it might show signs of local extension mimicking malignant tumors. The essential treatment remained as surgery. However, I could not find anything about a degenerating angiomyolipoma, not even any suggestion that it can degenerate. In today's world, when we don't know something, it's common to search for answers online. The information we find can vary widely, and it's easy to believe something without verifying if it's true or not. Although it was good news all around, little Marble remained ambiguous. Now that we have got that settled, I want to bring your attention to the swelling on the same kidney. I noticed this since you first saw me, but at that time, the more urgent thing to do was to remove your tumor, he explained. My state of euphoria suddenly plummeted. Something is obstructing the flow of urine. A possible cause was your tumor, but now that we have removed it, the swelling is still there. He continued his explanation. Let's give it a few weeks. We will look at it again when you next see me. If the swelling doesn't go away, we might need to put a stent into your ureter to drain the kidney. Then, in his signature style, he proceeded to show me various images of ureteric stents from an internet search. It looked painful and uncomfortable, although Dr. Dewo kept assuring me that it was a common procedure, and many lived with stents in their ureters. I had only heard of stents from Wano because she had one before, and it was agony for her. Thinking about it made me shudder. Inserting a stent is a simple procedure. You might not even need to be in the hospital overnight, Dr. Dewo explained. I was aware of it, since Wano described her procedure in minute detail, missing nothing. She could go home after her procedure, but what she went through seemed like a nightmare. It had been a week after I was discharged. My external wounds were healing considerably quickly, and my soreness and discomfort were almost gone. Although Dr. Dewo prescribed me with sufficient painkillers for various levels of pain, I didn't need any of them. Either I had a high tolerance to pain, or the pain was going away faster than what would be considered normal. However, Dr. Dewo did warn me that there was a lot that went on inside, so it was best that I resume my routine activities sparingly. Of course, I was not so dumb to physically overexert myself after a major surgery. Everything was going so well for me, I had a mind to think the swelling in my kidney would eventually go away when I next see him. 4th March 2022, Friday. 1 month after I was discharged from the hospital, my wounds were healing rapidly and well, but the ghastly swelling was still there. We have to find out why your kidney is swollen. We cannot carelessly dismiss this. Persistent swelling can lead to infection, which then leads to scarring, and that can damage your kidney. Dr. Dewo was concerned. At that moment, I feared the agony that I had to go through more than kidney damage in the long run. If it was left to me, I would probably sit on this for another 4 years. We don't need to decide on a stent now. We can do another CT scan to investigate this in detail. We will only put the stent in if absolutely necessary, he explained. When is a good time for her to do this, since she just had surgery so recently? Yoda asked. Let's do it exactly 2 months from her surgery. With that, a decision was made for me by these two assertive men without my input nonetheless. Thank you very much for listening. If you would like to keep following the story, click here to listen to the next chapter. And if you're new, you can start from the beginning by listening to the full playlist here. Don't forget to subscribe so you'll know when the next chapter is released. Until then, take care, take a deep breath, and I'll see you in the next one.